Hello everyone, so today we are going to do something on cerebrospinal fluid analysis, one of the tests that are done in the laboratory using the cerebrospinal fluid. So this is George, and from George's Solutions, a channel that majorly speaks of medical issues affecting our day-to-day lives and various tests that are done in the laboratory. And thank you for staying with me, and if you haven't subscribed, maybe you might consider hitting that subscription button. So right away, let us move to cerebrospinal fluid analysis. We will start with a bit of some anatomy, unusually to the way we always start every day. The brain and the spinal cord are composed of protective membranes referred to as the meninges. So the outermost layer is called the dura mater, and it is composed of tough connective tissues, and the middle layer is the arachnoid, named for the spiderweb appearance, and the delicate innermost layer, which is direct contact with the brain and the spinal cord, is called the pia mater. So an inflammation in the meninges is referred to as meningitis. So when there is an inflammation in the meninges, this condition we call it meningitis. So between the arachnoid layer and the pia mater is a space called the subarachnoid space. So it is actually this space that we are interested in because it contains a clear colorless fluid referred to as the cerebrospinal fluid, or the CSF. So along the video I'll be saying CSF. So whenever I say CSF, that means cerebrospinal fluid. In normal adults, approximately 20 milliliters is produced every hour, and the excess CSF is continuously reabsorbed by arachnoid villi, and it is returned to the venous system, thus maintaining a consistent amount of fluid under the intracranial pressure between 50 to 180 millimeters of mercury. So generally, the total volume of CSF circulating throughout the adult central nervous system, that is the brain and the spinal cord, is approximately 90 to 150 millimeters. In newborn, this volume is 10 to 60 millimeters. So, what are some of the functions of the CSF? So the functions of the CSF is to protect, support, and cushion the brain and the spinal cord against any possible injury. The CSF also, it is used to deliver nutrients from the blood to the central nervous system, and also it removes wastes from the CNS. Bathing of the brain, and it also bathes the brain and the spinal cord, and it acts as a shock absorber or a buffer to the brain and the spinal cord, and it regulates the contents of the cranium. It keeps the brain and the spinal cord moist, and it acts as a cushion between the brain and the cranium. It transports hormones and hormones releasing factors, and it removes metabolic waste throughout the absorption. So there is something that we refer to as lumbar puncture that I think is of important for us to look at it. So actually lumbar puncture is also called the spinal tap, and I'll take you through it. It is whereby a needle is inserted aseptically. It must be very sterile, since the CSF is one of the privileged parts of the body, between the vertebrates level L3 and L4, or L4 and L5, and a fluid is collected aseptically from the subarachnoid space, and it is placed in 3 sterile tubes numbered in the order of collection 1, 2, 3. So the patient is placed in a side-lying position with the head flexed onto the chest and the knees drawn up, but not compressing. You don't compress the child, of course. The abdomen to the back. This position helps to increase the space between the lower lumbar vertebra that the spinal needle can be inserted more easily between the spinal processes. However, a sitting position with the head flexed to the chest can be used, and the patient is helped to relax and instructed to breathe slowly and deeply with his or her mouth open. So first of all, you select the puncture site, and there is a small bony mark at the L5 S1 interspace known as the surgeon's delight that helps to locate the puncture sites. The site is thoroughly cleaned with antiseptic solution and the surrounding area is draped with sterile towels in such a way that the drapes do not obscure important landmarks. So then we make our injection and we remove the specimen consisting of up to 20 milliliters of CSF. So tube 1 is used for chemistry and serology. Tube 2 is used for special studies such as cryptococci, antigen, syphilis testing such as the VDRL, Venereal Disease Research Laboratories, protein electrophoresis and other immunological studies, and a closing pressure reading may be taken before the needle is withdrawn. Tube 3 is for culture, gram stain, AFB and Indian ink. Tube 4 is for cytology. So specimens of the CSF are immediately delivered to the laboratory and they should be given to the laboratory personnel with specific instruction regarding to the testing that should be done. Those should never be placed in a refrigerator because refrigeration alters the results of bacteriological and fungal studies. Analysis should be started immediately like I said before. And if viral studies are to be done, this is the only point whereby we can allow refrigeration. Record the procedure, start and completion types, patient status, CSF appearance, and the CSF pressure readings must be recorded. Its ionic composition is the same as that of the plasma for some components and differs from others. For example, in general, the CSF glucose concentration is 60% of the serum. Sodium, chloride and magnesium are the same or greater than serum, but potassium, calcium and glucose are lower than that of the serum. So active transport in and out of the CSF space is probably responsible for maintaining these differences. So there is active transport in and out of the CSF space. So there is a need for sufficient CSF amount for microbiological and biochemical investigation. Zancochromia, it is usually advised to possibly collect sequential specimen into universal containers. So you label 3 28mm sterile white top plain universal containers and 1 gray top fluoride oxalate tube with the patient name, hospital number, ward, date and birth, the time that the CSF was obtained and the sequence of sampling. So collect and transfer 0.5 ml CSF into a gray top vacutainer for glucose and you label it 1. Transfer 2 ml of CSF into each of the 3 sequentially numbered sterile 28mm universal containers labeled 2, 3 and 4 respectively. So what are some of the things that we note down when we obtain CSF? We note things like volume, whereby in adults it's supposed to be 150, it's supposed to be 90 to 150. The appearance, is it crystal clear, is it colorless? The pressure, whereby the pressure in adults should be 90 to 150 millimeters of mercury, and in children it should be 10 to 100 millimeters. The cells, it should be nil, or if the cells are there, they should be less than 5 lymphocytes, both in adults and in children. The specific gravity is 1.006 to 1.008, both in adults and in children. The pH is 7.28 to 7.38, both in adults and children. The WBC is 0 to 5 in amount in adults and 0 to 30 cells in children. The lymphocytes should be 40 to 80% in adults and 5 to 35% in children. The monocytes should be 15 to 45% in adults, 50 to 90% in children. The polyps should be 0 to 6% in adults and 0 to 8% in children. Protein should be 15 to 40 milligrams per deciliter, of course, Albumin should be 10 to 35 milligrams per deciliter. Globulin should be nil both in adults and in children. Urea should be between 15 to 40. Chlorides should be 120 to 130. Sodium should be 138 to 150. Hydrogen carbonate should be 20 to 40. Glucose should be 45 to 100 in adults and 2.2 to 80 milligrams per deciliter in children. Bilirubin, of course, should be nil, both in adults and in children. Osmolality is 292 to 297. Creatinine is 44 to 106. Phosphorus is 1.2 to 2.0. Uric acid is 0.5 to 4.5 millimole per deciliter. So the routine examination of CSF, of course, it is obtained by lumbar puncture, and the spinal fluid is used for the diagnosis of major diseases such as meningitis, subarachnoid hemorrhage, CNS malignancy like meningeal carcinoma and tumor metastasis, and autoimmune diseases such as multiple sclerosis can be used to diagnose. CSF can be used to diagnose those one. So bloody CSF may be as a result of traumatic tap, in which blood from the vascular damage during the performance of the lumbar puncture has occurred, or from hemorrhagic CNS. There is also a phenomenon whereby we refer to as Zancochromia, which is a yellow color. Zancochromia simply means a yellow discoloration of the CSF. It results from the presence of blood pigments derived from red blood cells that have undergone lysis, for example bilirubin. Also something we refer to as physical examination of CSF. So we require pH meter or pH papers and hand refractometer to determine the pH of CSF. So we do cell count when we are analyzing CSF, whereby we do total cell count of blood cells, and we require, of course, a Neuber counting chamber or a Fuchs Rosenthal counting chamber, and a diluting fluid, a microscope, and a RBC or a WBC pipette. Then we will count the number of cells. Then we can do differential WBC count, whereby we want to now note down the different types of WBCs that are present in the CSF. We can also stain the CSF using Leishman stain to stain it. We can also do some Indian ink. The clinical interpretation of CSF, large number of polymorphs can be as a result of pyogenic meningitis caused by Neisseria meningitidis, Haemophilus influenza, pneumococci, streptococci, staphylococci, coliforms, sometimes viruses, and rarely fungi cause meningitis. And mixed reaction such as neutrophil, lymphocyte, and monocytes is seen in subacute bacterial meningitis, tuberculous meningitis, mycotic meningitis, and viral meningoencephalitis. So monocytic and lymphocytic reactions is seen in viral meningitis, multiple sclerosis, tuberculosis meningitis, fungal meningitis, and syphilitic meningitis. So lymphatic reaction alone also is seen in diseases mentioned in the first one, whereby I was speaking of Haemophilus, pneumococci, streptococci, staphylococci, and coliforms. So blast may be seen in leukemic cell infiltrates in the meninges. Malignant and benign cells may be seen in certain neoplasm of the CSF. We also do glucose analysis to the CSF, whereby glucose should be between 50 to 85 milligrams per deciliter. A decreased level of glucose may be due to meningeal involvement in malignant tumor, acute syphilitic meningitis. All those conditions can lead to reduced CSF glucose. That was a brief description of CSF analysis. Thank you for staying with me, and if you like the video, you can share, like, comment, but the most important one, don't forget to subscribe to my videos. Thank you for staying with me. That was Judge's Solution. Bye.